Good morning, everyone. Today's lecture explores one of the most common orthodontic findings, increased overjet. We'll learn how to recognize it, diagnose it accurately, and plan treatment using both functional and fixed appliances. But beyond teeth, we'll also discuss how increased overjet affects patients' lives, confidence, and even trauma risk. Learning objectives. By the end of this lecture, you should not only know what overjet is, but also understand the human and biological story behind it. Clinical case introduction. Young girl, age 11. Our case centers on young girl, an 11-year-old patient whose upper incisors are prominent. Her mother reports that she's being teased at school, and young girl recently suffered minor trauma to her upper central incisors. This single case will guide us through every principle today. What is overjet? Overjet is the horizontal distance between the upper and lower incisal edges when the teeth are in centric occlusion. It's measured parallel to the occlusal plane. A normal overjet is about 2 to 3 millimeters. Anything beyond that is considered increased. Why it matters. An excessive overjet isn't only aesthetic, it affects lip seal, speech, mastication, and trauma risk. Children with an overjet above 5 millimeters are twice as likely to experience incisor trauma. Psychosocial impact. Studies across Europe show that 1 in 5 schoolchildren experience bullying. Among those assessed for orthodontic treatment, 13% reported bullying due to malocclusion, most often protrusive incisors. The psychological toll can persist into adulthood, influencing mental health and self-esteem. Teasing versus bullying. It's essential to distinguish teasing from bullying. Teasing can be ambiguous or playful. Bullying involves repeated aggressive behavior, creating a power imbalance. Recognizing this helps us decide whether early orthodontic intervention is justified. Case history summary. Young girl's teeth have been prominent since her primary dentition. She recently fell and chipped her incisors. She also has asthma, managed with Ventolin, relevant when prescribing certain materials or during appliance therapy. Extraoral examination. We begin by assessing the skeletal pattern. Young girl exhibits a Class II skeletal relationship with a convex profile. Lower facial height is slightly reduced, and her Frankfurt mandibular plane's angle, FMPA, is low. Lips are competent, but the lower lip rests under the upper incisors, a subtle soft tissue driver of overjet. Intraoral examination. Her arches are well aligned, with a full permanent dentition and no crowding. Overjet is 7 millimeters. Overbite is complete and deep. Buccal segments are half-unit Class II bilaterally, and there's a lingual crossbite on the right first premolar. Key diagnostic points. Remember, overjet is a symptom, not a diagnosis. Our task is to identify the skeletal, dental, and soft tissue contributions that create it. Radiographic assessment. Radiographs confirm all permanent teeth present and healthy. Cephalometric analysis shows SNA around 82 degrees, SNB around 76 degrees, ANB around 6 degrees, consistent with a mild Class II skeletal base. MMPA around 22 degrees, indicating reduced vertical dimension. Understanding cephalometric. For undergraduates, remember these core values. ANB more than 4 degrees considers Class II. ANB around 2 degrees considers Class I. ANB less than 0 degrees considers Class III. Mandibular growth direction. Smaller angles mean horizontal growth. Growth assessment, CVM, cervical vertebral maturation index, helps determine timing for growth modification. Peak mandibular growth occurs between stages 2 and 3. Young girl is right at that window, ideal for functional appliance therapy. Etiology of increased overjet. Let's summarize the causes. 1. Skeletal, usually mandibular deficiency, Class II. 2. Soft tissue, lower lip trap, hyperactive lower lip. 3. Functional, tongue thrust or atypical swallow. 4. Habits, prolonged thumb sucking more than 6 hours per day. 5. Dental, labial displacement of upper incisors or lingual displacement of lowers. Clinical analogy. Think of the orofacial muscles as elastic bands. If the lower lip rests behind the upper incisors, its constant tension pushes the upper incisors forward and pulls the lowers backward. Habits simply amplify that imbalance. Treatment objectives. The goal is a balanced occlusion, healthy soft tissue function, and a confident patient. For a growing child, the first step is functional appliance therapy. Functional appliances overview. Functional appliances can be removable or fixed, tooth-borne or tissue-borne. The twin block is the most popular in the UK because it's comfortable, aesthetic, and highly effective. Cochrane evidence. Systematic reviews show that early treatment reduces incisor trauma but otherwise offers no major long-term advantage over adolescent treatment. However, for children like young girls who are teased or have trauma risk, early interceptive therapy is justified. Twin block design. The twin block uses two separate acrylic plates with buccal blocks set at nearly 70 degrees. When the patient closes, these planes guide the mandible forward into a postured position, stimulating both skeletal and dental adaptation. Biomechanics of twin block. The forces generated by occlusion and orofacial musculature encourage forward mandibular growth and retraction of the upper incisors. About 70–80% of the effect is dento-alveolar, 20–30% is skeletal. Clinical example. After 6 to 9 months of consistent full-time wear, most patients show clear improvement in profile, incisor inclination, and lip competence. Instructions to patients must wear the appliance full-time, including during meals. Remove it only for cleaning or sports. Mild soreness is normal for the first few days. Reassure patients to persevere. Managing posterior open bite. A posterior open bite often appears after overjet correction. You can resolve it by trimming the lower acrylic gradually, allowing posterior eruption, or by switching to a retainer with an anterior bite plane. Second phase, fixed appliances. Once functional treatment is complete, fixed appliances are used to detail the occlusion, aligning, leveling, and coordinating arches before final retention. Retention and stability. For stability, ensure the interincisal angle around 135 degrees plus or minus 10 degrees, full overjet correction, and balance soft tissue function. Nighttime wear of retainers should continue until growth completion. When treatment fails. If no improvement is seen after 6 months, reassess. Is it compliance, design, or growth limitation? Reevaluate and plan accordingly. Key take-home messages. To conclude, increased overjet is not a trivial aesthetic issue. It's a clinical condition with real psychosocial and functional consequences. Early recognition, thoughtful treatment, and clear communication can change both smiles and lives. Thank you for your attention. Understanding these methods is key to appreciating the science and artistry behind creating beautiful, healthy smiles. Thanks for watching, and we hope this video has helped you better understand this vital aspect of orthodontic treatment. So, the next time you see a stunning smile, you'll know the incredible science and artistry that may have gone into creating it. If you're a student interested in dentistry or orthodontics, we hope this video has given you a glimpse into this exciting field. Don't forget to like, subscribe, and hit that notification bell for more educational content. And if you have any questions, drop them in the comments below. Thanks for watching.